Please keep your microphone on mute at all times, except when you're invited to speak. And when you do so, make sure you have your camera on. If you have any technical difficulties, please put a note in the chat room. We have staff who will help you deal with those technical issues. Next slide, please. Also on Zoom, we have captioning. So you will see that there is a closed caption icon bar at the bottom of your screen. You can go to that bar and press either hide subtitle, view full subtitles, or you can ask to view the smaller version of the subtitles, in which case you will see both. And you can adjust the size of the captions under subtitle settings. In addition, please note that in the chat room, there is a link to a separate webinar file on captioning if you prefer to have two files open, one for the session itself and one for the captioning. But that is not necessary if you use the closed caption function right within Zoom. Next slide, please. So as I mentioned, the world has changed as a result of COVID-19. And the International Federation of Hard of Hearing People, along with the International Federation of Hard of Hearing Young People, and our regions in Asia and Europe, wanted to find out how exactly is it impacting on hard of hearing person. As a result, we undertook a survey, and we have posted the results of that survey on our website, both on the website for IFHO and the website for IFHOH. It's www.ifhoh.org and www.ifhohyp.org. Besides sharing the results of the survey, we will discuss some of our advocacy efforts to date and issues, of course, arising from the survey and related to COVID-19, as well as sharing resources and technologies that may help us deal with some of the challenges we're facing during this pandemic. Next slide, please. So the agenda is such that after I'm speaking and for this introduction, we will have a summary of survey results by Bowen Tang. He is the president of the International Federation of Hard of Hearing Young People. And both Bowen and I will address the advocacy steps taken by our organizations. And then we have a session of captions on internet platform by the Vice President of IFHO, Avi Blau. Next slide. Here is our contact information, should you wish to reach us. And this is on the next slide. And I, at this time, would like to express our thanks to our captionist, who is Tracy Reinke, our international sign interpreters, Dennis Hugiven and Adam McCormick. And I'd also like to thank the IDA staff, Dragana Djokovic and Emma Pan. So with these introductory comments, we're ready to roll. The other thing I would like to say is that we will have an opportunity for questions after each speaker. So we will reserve some time for questions as we go along, and then we will have a final question period towards the end. And any comments at this time, please put it in the chat box. I will just go and check the chat box at this time to see if there's any comments. So in the chat box, you will find the link to the separate website for captioning. So please do go to that particular website to get the captions. Okay, over to you, Bowen.
Thank you very much, Ruth. If I may ask the survey with a PowerPoint be put up. Thank you very much. Good morning, good evening, wherever you are in the world. My name is Bowen, and I am the president of the International Federation of Hard of Hearing Young People. It is my pleasure to be able to present to you the global report of COVID-19's impact on hard of hearing people. So Ruth and I, we work on this together when we received emails and comments from our members earlier this year at the beginning of the pandemic, outlining some of the challenges that they've experienced in the communities. So that led us to wanting to develop a survey. Next slide, please. So the background behind this survey is to look at what exactly are the barriers and challenges faced by the hard of hearing people around the world in the different aspects of their lives, so such as the daily communications in public places, or whether it be for the education and their workplace environments. So we wanted to have a way to measure what the impact of COVID-19 on people with hearing loss. So this survey focuses on 5 key areas. Next slide, please. First is the public accessibility. So for example, looking at how the deaf and hard of hearing people are able to obtain the public information about COVID-19, which is very essential that we understand what the government recommendations are when it comes to health guidelines during this time. The next one, we look at face masks and social distancing challenges and how it affected our ability to communicate with other people. The third area is online communication. So like I said, how it impacts our usual interactions in the schools and the workplace environment. Next, we look at the healthcare and how there are barriers preventing deaf and hard of hearing people from accessing the healthcare system. And lastly, we inquire about the socio-economic impact on people with hearing loss due to the COVID-19. Next slide. So first, the demographic profile of our survey, it was sent in July, and we had a month period to collect responses. So in total, we had 166 responding to our survey. 66% of the respondents identify as hard of hearing, 15% are deafened, 12% identify themselves as deaf, so referring to those who use sign language as the primary mode of communication. And there are less than 4% who identify as hearing. 74% wear hearing aids as their assistive devices, with 24% wearing a cochlear implant. In terms of ages, we have quite a balanced group. So we have 30% that's less than age 35, so that represents the youth population. And more than 50% are between ages 36 and 65, and 40% are age 66 and older. In terms of geography, the majority of the respondents are from Europe and North America. We're still able to get responses from areas in Asia, as well as a few in Africa and Latin America and the Pacific regions. So all in all, we feel that the demographic profile will give us the general picture of what the challenges that hard of hearing people are facing. All right, so let's move on to our first area. The next slide, please. So, public accessibility. Again, this focuses on looking at how we're able to access public information that are presented in the live TV broadcast when the government hosts their emergency press conferences to declare state of emergency and all the health protocols in response to COVID-19. What we found was that even though there are some captioning provided in certain broadcast channels, the sign language interpretation is often more provided than other forms of access. So sign language, it's great news to see that the sign language interpretation is becoming more of a norm to include in those public broadcasts. But these may not meet the needs of hard of hearing people who rely on oral communication. So there's still a group of us who are not able to access the information real time because there are times when the captions lag. So that means we're not able to follow the information real time and there's a certain delay. When it comes to online media, feedback from the respondents have noted that the captioning feature is not made easily accessible. So what that means is, yes, there are captionings available, but it requires on the user's part to spend some time to figure out where the captioning feature is. And by doing that, we lost the time to be focusing our attention on the information when we're trying to activate the feature. So this means that there still needs to be some work to make sure that captioning is easily available so that when we click on the online media, we don't have to do any extra work and just be ready to absorb the information completely. Next slide, please. So next we look at the face mask and the social distancing challenges. So as you can see on the graph on the left side, so we compare the rate of difficulty for a hard of hearing person to understand someone else who wears a face mask versus understanding someone who wears a face shield. So evidently, we see that for the graph with the face mask, the majority of the respondents show that they're having difficulty understanding someone with a face mask. Only 8.5% of the respondents show that they are able to understand someone with a face mask. And now we see that Ruth is wearing one which will make it so much easier for us to understand. Okay, so that is an example of how we're able to provide more access to a hard of hearing person who rely on speech reading. Another option is to consider the use of face shields. So if you look at the graph at the bottom, we see that people having a significantly less difficulty understanding someone who wears a face shield. So I have an example of a face shield right here. So you can still see my face quite visibly. I haven't had a chance to open this yet just to make sure that it stays clean. So the results from the survey indicated that 72.2% of the respondents, thank you, Ruth, for demonstrating what the face shield looks like. So 72.2% of the respondents show they are able to easily understand someone wearing a face shield. Okay. So that's 72.2% versus 8.5%. So we really highly encourage that all the frontline workers consider the combination of using a face mask and a face shield so that they can remove the face mask while keeping the face shield on. So there are times when it may not be possible. So our usual strategies will be to ask the speaker to repeat. But these usual strategies don't work quite well during this extraordinary time because there's still 67.9% of people still having difficulty understanding even when they ask for repetition. there are still some of us who encounter more impatience than usual from other people, with some of the people feeling that we're trying to trick them to take off their mask and leading them to feeling angry with us and being rude to us. And altogether, it's just becoming very frustrating for those of us who really rely on the visual form of communication and the cues to understand the information that's being presented to us. Yeah. And despite the belief that just by speaking louder and yelling at us from a 2-meter distance will make it easier to understand, the fact remains that the social distancing makes it even more challenging for us to be able to hear the information, even if the person is trying to yell as much as possible. So again, we really encourage the use of the clear face mask and a face shield so that we're able to see the person's faces while maintaining social distancing. All right, next slide, please. Mm-hmm. Yeah. So now moving on to online communication, we first ask our participants what the platforms they use. And needless to say, the most common platform is Zoom, okay? Making up 71% of the responses, followed by the Facebook Messenger and FaceTime, as well as Google Meet. Yeah. Now, all of these platforms may not necessarily have a captioning feature. What I mean by that is the captioning feature is already embedded into the platform. So right now on Zoom, we have the pleasure of having Tracy as our captionist, but that means we have to rely on a third-party provider to be able to use the captioning feature on Zoom. In regular circumstances, if the organizer doesn't provide captioning on a Zoom platform, we're left with no access. So that means we have to look at other alternatives such as Google Meet and Microsoft Teams where they do have automatic captions already. But again, because they are automatic, so it really depends on the speaker's accent and the rate of speech to ensure there is a high level of accuracy. So that means it is not always guaranteed that automatic captions can provide the 100% accuracy. So here we want to emphasize that even if there are platforms with automatic captioning features, they do not replace the live captioners. We do emphasize that the live captioners ensure quality of the information that we receive, especially when we attend important meetings such as for our schools and our workplaces. So this is a point that we want to highlight. Even though we are very happy to see the development of those new technology to enable some flexibility when live captioning is not possible. One interesting result that we found was that despite the increasing development of the subtitling apps, a lot of the people do not know about them or how they work. So this gap is reflected in the following respondents' comments of having limited experience and knowledge around subtitling apps. The several respondents call for education and training on using these apps for day-to-day communication. So if I may, I'd like to show a quick example of this Google Live Transcribe. And so this can be used when I'm going to a grocery store and I can't obviously bring a live captioner with me. So I can place this live transcribe in front of the speaker and ask the person to speak slowly and clearly. And then it will be able to capture the person's speech as accurately as possible. If not, I can always use the context to fill in the missing piece of information. So that's one example of the subtitling app called Google Live Transcribe. There's also Microsoft Translator other and many other that we'll be talking about later on in the presentation. Next slide, please. Next, we look at the healthcare. So naturally, healthcare is very important to all of us, but even more so when we depend on the hearing healthcare, such as looking at fixing our hearing aids and cochlear implants so that we're able to listen at our best. So 2/3 of the respondents indicated that access to the hearing care, cochlear implant care, and general health care was impacted by COVID-19. So for example, appointments were canceled, as with any other healthcare appointments, or they're postponed for several weeks or months. That means if some of us has a broken hearing aid, or if the cochlear implant is malfunctioning, we are left with nothing. No alternative for us to be able to utilize our devices. So that means we are completely excluded from the community, because without those devices, we're not able to function in our workplaces or in any other settings that we are in. Some of the cochlear implant users spoke about a delay in the surgery or even a delay in aftercare. So if they happen to just completed the surgery and then the pandemic hit and they were about to get hooked up with the processor, they had to wait an extra month longer, which means again, they don't have any technology to be able to help them communicate with people around them. The other point that really leads to the frustration is when the appointments are able to proceed on a virtual basis. So that means even if in-person appointments are not possible, the virtual options are still offered. But what's frustrating is that for those virtual appointments is that a lot of the healthcare professionals only provide the phone option, which means we can only talk to those people on the phone, which is not adequate at all for those of us who don't do well speaking on the phone, and that we will benefit more from a text-based form of communication, or like right now, a video-based form of communication. The one respondent said that both her respiratory specialist and her general physician are refusing to see her in person and insist on doing everything by phone. Okay. Sometimes the doctors just don't want to do it, or sometimes they want to do it, but they are forbidden from doing so due to the health regulations. So we have two scenarios where some doctors just don't want to do it, and their hands are tied by the health regulation due to the Privacy Act, which we acknowledge. So we're hoping that the health official will consider looking at the guideline to provide flexibility for the healthcare professional to adjust their way of communication to include other forms of communication so that deaf and hard of hearing people can be included in the healthcare process. So that's very important for the health officials to look at. Next slide, please. And lastly, we look at the socio-economic impact. Okay, because they don't have the ability to look at the hearing aids and cochlear implants fixed, they're not able to perform in the workplaces, which means that some of the respondents have to take a leave of absence from their employment, which in turn affects the level of income. So that is the number one impact that is aligned to the healthcare system. There were some suggestions that in some countries where hard-of-hearing persons were less recognized for social assistance and support than other groups in society. So some of the benefits are not applicable to us because we are seen as an invisible disability compared to other disability groups. Altogether, the pandemic has taken a personal toll and resulting in loneliness and isolation, with some people citing that they're feeling depressed. These are the findings that we have discovered through the survey. So we would like to thank all the participants for sharing their experiences. And that leads to our final part of this survey presentation. Next slide, please. Is that we have developed 10 recommendations, some of which are included here for the purpose of this presentation. The first and foremost, we recommend that government, medical public services, and employment should consider the use of clear and transparent face masks that meet the standards for full inclusions of all clients, as well as the combination of face shields and a face mask in the event that a clear face mask is not possible. Medical professionals should be informed about alternate communication options, either visual or written, for interacting with hard of hearing persons rather than complete reliance on the telephone. If there are regulatory barriers, they should be considered to be changed. Open closed captioning should be made regularly available on all media platforms that broadcast public information, so that we do not need to make the extra efforts to click on the captioning feature. Again, we emphasize that the use of automatic captioning does not substitute for the provision of captioners or speech-to-text interpreters due to the high level of accuracy than in the automatic systems. And lastly, more education should be provided about the automatic captioning apps. And that concludes the survey presentations. And we'll be talking about the advocacy effort that we're doing to push forward those recommendations. So back to you, Ruth. Mm-hmm.
Thank you very much, Bo. And the results of this survey are very exciting. Some of them are not surprising. It's not surprising to learn that being able to understand people when they wear a face mask that covers their lips is very difficult for us. So as a result, we're promoting the clear mask, as we showed you earlier, and also potentially the use of a face shield. Some of the other findings are that there's an impact on individuals in the workforce who are working with others, and I had an opportunity to talk to a teacher who's hard of hearing, and she's very concerned about how she's going to be able to hear all the parents when they come to the school dropping off their kids or visits, when they're wearing cloth covering mask. So I did urge her to talk to her school principal and get them to provide the parents with the clear face mask. They are providing them with 2 masks. So and there is a supplier in our community who is making clear face masks. But I do feel for her because it's a source of great stress for her. The other thing that came out of the survey that perhaps was not surprising, but it's not something we talk about a lot, which is the heightened sense of isolation and loneliness that some people experience. And we did have one recommendation about that this is a topic that we need to explore more. I think that as hard of hearing people, communication has been affected during the pandemic, and using the phone or with the use of the face mask covering the face, those have all impacted on our ability to communicate with other people and our sense of being connected, leading us to feel a little more isolated and lonely. So the session is open for your questions at this point. If anyone has any questions they would like to direct about the survey. We will check the chat room for your questions. I just want to give a little bit of time for people to be able to type in their questions. So maybe I could ask you a question to start off, Bowen. What do you think will be the single most effective thing that can be done for hard of hearing people to have greater access during the COVID-19 pandemic?
I think that the strategies vary depending on the situations that the person is in. What I find to be quite empowering is that I think even from my personal experiences going through the different situations, so just doing my groceries and going to the medical clinics, is that I always made the assumption. I used to make the assumption that people couldn't be bothered with accommodating me just by asking them to make a slight changes. So I try to put it all on myself to accommodate as much as possible. Just feeling that I have to sing even better than I usually would, and that puts a lot of stress on myself. So what I learned was that it is okay just by having a conversation with the people that I'm talking with, and just by informing them that I have a hard time hearing you because you are behind a plastic glass and your face is blurred. Would it be okay if I can read the lips? Because that's just a simple question to ask, and they may say no, but there's also the possibility that they may say yes. So I think the important thing that we can do is just ask those simple questions and see where it goes, because otherwise we're just putting a lot of the stress on ourselves to do the work. And we really should take a leap of faith and trust that the other person may be open to helping. And by doing so, when we inform people, what they can do to adjust their communication, we're not just helping ourselves, but we may be helping the people that come after us and make it easier for them. And we will have gained new allies for people who now understand what it takes to include the hard of hearing people. And that will be my recommendations to just start by having a conversation, educate people, and I think you'll have more positive experiences than we assume. Yeah. Mm-hmm.
Thank you, Bowen. Mm-hmm. I have one person who has their hand up. I will ask the organizer if they would kindly allow for the video and verbal speaking for Johara Sultan. Just so we can see what the question is or the comment from the person. Yes, go ahead.
Yes, ma'am.
We can't hear you. Please repeat your question. And could you show your video?
I don't have a question, ma'am. So why do hard of hearing? Why do people have It is done, Mom. I don't have any questions. I forgot. Sorry, Mom.
Okay, well, thank you very much. We've clarified that there's no question coming from the individual. So we will, and we do not have, I see any comments right at the, well, we do have potentially a comment here now in the chat room. One has just come up. I'm just going into it. So, so we have a comment from Lauren Reyes saying that they're happy to be part of the webinar and glad to inform us that they fully support our recommendations, and it is timely on the occasion as we are discussing and planning on our project in the province in response to the global pandemic entitled Provincial Convention Summit on Disability Inclusive Humanitarian COVID-19 Response 2020 Vision for Taking Inclusion. And it's very relevant to the project in terms of what we're discussing. And more education should be provided to hard of hearing people about automated captioning apps. And to add to this is the need for trained individuals who can train youth advocates to become future captionists or speech-to-text interpreters, and to raise awareness about disability concerns of hard of hearing persons, such as have been identified through the survey about COVID impacts on hard of hearing people.
That's fantastic. I'll be curious to know which country is Lauren from.
Hello. Hello, good evening.
Yes, go ahead, Lauren.
I'm from the Philippines.
Thank you. Lauren is from the Philippines.
Well, thank you.
We are collaborating with Sir Ralph Turalba.
I think you said that you're collaborating with Ralph Calabra.
Yes, Ralph is a member of the Asia Pacific Federation of the Hard of Hearing. Excellent. We did have a lot of people from the Philippines register for these workshops. And as you know, we had our first session last week. Some of you may know this, not everyone. That just happened to be the time that Zoom crashed all over the world. So we did have the session last Monday on a different platform, but we are offering it again today. So I think we will move on to the next part of the program, just to keep on schedule. And that will be the PowerPoint presentation about policy, if we could have that on the screen. So I will start off this session by just identifying some of the policy and program initiatives of IFHOH. But I will start by saying that people who assume that it's been quiet and not terribly busy, in fact, it's been the opposite during the pandemic. It's been busier than usual, partly because of the increase in communication through all the webinars and online communication related to the COVID, and also related to other activities. So the increase in activity related to other initiatives and the increase in meeting electronically has been a positive thing, I think. The other increase has been due to disruption in usual plans, and one of them for us was our biannual meeting in Congress, which we've had to postpone, but we also had to find alternate ways to be able to deal with some governance issues, which we managed to do through email. So on to some other advocacy efforts. Next slide, and I'm just going to take a break to get a glass of water. 1 second. Okay, so we started off, first of all, with contacting the Director General of the World Health Organization, because when they were doing their daily briefings, they weren't captioned, and this was a lack of access for us. So we called for the briefings to be captioned, and we asked for this starting in March, and by the end of April, they began to caption the briefings. And not only did we ask for it, but as part of the International Disability Alliance, we urged them to make this request in their advocacy efforts. So I think it was a result of several parties going to the Director General saying this was important. We prepared a release early on about the pandemic, emphasizing access needs and expressing concerns about its impact on communication and about face covering masks and social distancing. So right from the beginning, this was an issue that came forth in our community that we tried to bring to the attention of policymakers. Did it have that much of an impact? Awareness is always difficult to measure. I think that to start with, they were just really overwhelmed with dealing with a pandemic. And it's only now that things have kind of, they haven't leveled off because we're going through a second wave, but what has happened is that there's been more time to consider our issues. We do have a COVID-19 page of resources on our website, and our website is www.ifhoh.org. And as you know, we've conducted a survey on the COVID-19's impact, as has been discussed by Bowen. Next slide. And we have been very active with the International Disability Alliance and the International Disability Development Consortium in terms of joint efforts to raise awareness about the COVID's impact on people with disabilities. And in particular, we have raised issues related to our community, the hard of hearing persons community. As a result, I was a participant in an IDA-sponsored webinar in June. And more recently, and going to press in a day or so, is a joint statement with the World Federation of the Deaf and the Youth Federation of the Hard of Hearing regarding access issues for hard of hearing and deaf persons during the pandemic. So we will have the IFHOH journal going to press in a day or so, and we will have the full text of the joint statement within the IFHOH journal. And if you are not already on our mailing list and would like to be on our mailing list to receive notification of such releases, please email me. My email is president@ifhoh.org. Over to you, Bowen, to talk about IFHOH's HIPS efforts and advocacy.
Yeah, thank you, Ruth. So in response to the COVID-19 pandemic, our organization has formed an accessibility committee. And the idea behind that committee is to look at what solutions we can come up with to address the barriers that are faced. So what we came up with was developing a global inventory of clear face masks and face shields, so that people can look up at this inventory and find out where the closest place that they can acquire the mask and the sales from. We do not endorse any of the manufacturers that we put on the inventory. It is all for the informational purposes. It is up to the person responsibility to look up whether the face masks and the face shields match with what their needs are. We're just putting everything together in one platform to make it easier for the people to look up rather than browsing through so many different websites on the internet. And that's one thing that we did, the global inventory. The other thing that we also came up with is looking at how the hard of hearing student can continue online learning. So what are the strategies and technologies that they need to enable access for online learning. So for example, it's showcasing the different apps that they can use, as well as like communication strategies with the instructors on what needs to be done during a meeting. So for example, muting the microphones while one person speaking, making sure there's adequate lighting so the person's face can be seen easily. So all of these can be found on our website, which is different from IFHOH. So our website is www.ifhohyp.org. So our resources are primarily dedicated to young people as per our mandate, but really it is applicable to everyone. So we encourage you to check out our website for those resources as well. Okay.
I might just add that the resources that the youth have developed are tremendous. And we haven't duplicated them because there's the benefit in not duplicating efforts, but rather have a link to the resources from our website as well. And we do want to hear from you if there's something that you think we should be doing or some issue that you would like attention to be paid to. Let us know, please. So we're open to questions if there's any questions or comments at this point. It can be both about our policy efforts, about the survey, or about pandemic issues that you've faced. I see a comment in the Q&A. I'm just going to go in there. So a comment in the Q&A from Lauren Reyes of the Philippines is, we hope to invite resource persons from the organizations of hard of hearing in educating communities. Thank you.
So I think I can speak a little bit on that point about what IFHOH is doing. So recently I have the pleasure of speaking with Ralph about like providing information about what captioning looks like here in North America so that they can have something started in the Philippines and just giving them the basic foundation of what a captioning does, what a caption list does. So like knowing how to identify key information and communicating with the presenters and obtaining materials. So that's part of the education effort on our part to inform the communities who may not have as much familiarity with the captioning access as we do here, so that they have a starting point to make it possible for the hard of hearing people in those communities to have access to those technology. The other thing that I didn't mention was like one of the regions in the world that's having a significant challenges not just having their own difficulties, but in terms of inter-exchanging information with other parts of the world, is Latin America. Because their primary language is Spanish. So it's not often easy for them to get the information from outside and trying to apply it. So one of the things we've been doing is work with one person in Bolivia, where we will try to look at building a platform where it showcases the different accessibility tools that the person can use and demonstrating the step-by-step on how to use those tools. So that's the very beginning of the process. We're still in the process of a conversation, figuring out how to do it. But the idea is to try to translate the resources that we have here in North America and Europe and putting it in Spanish so that people in Latin America are aware what are the possibilities, because it's often that they don't know what's out there, that they don't know what the possibilities are, and therefore limit what they can do. So, yeah.
Okay, so I think we will move on to the next part of the program, which is for the PowerPoint on captions on internet platforms for hard of hearing persons during the COVID-19 pandemic. Could we have that PowerPoint on the screen, please? Very good, thank you. Here is the PowerPoint by Avi Blau, Vice President of IFHOH. Avi was unable to, I guess, join us this morning. So, or here, Avi?
Yes, I'm here. I was only late a few minutes.
Glad to see that you're here. Please go ahead with your presentation. And could you show your picture on the screen?
Yes, but somehow I cannot start the video. You cannot see me on video because the operator have to allow me to show the video.
Okay. We will ask our technology assistant if you could please show Avi's video.
Oh.
Excellent. There you are.
Okay, thank you. Now you can see me. Hello, everyone.
Yes.
I am glad to show you some information about captions on the internet on several platforms. We will do it especially for a video conferencing platform like the Zoom that we are using right now. And we will try to give you some information about tools that can help you to do it on the better way. Next slide, please. Okay, in this slide, you can see on the left side, several names of video conferencing platforms. The first one is Zoom, that is the most popular platform these days, but you have other platforms like Google Meet, Google Hangout, Microsoft, Skype and Teams, and Cisco, WebEx, and GoToMeeting, and there are many other platforms that are used today. But as I said, Zoom is the most widely known, and it is used by most of the people in our times of the COVID-19 pandemic. On the right side, you can see another list. This list is tools that can produce captions, and they can do it in several ways. Some of the ways can be combined with the video conferencing tools on the other side. Some of them are independent. We will talk about some of them and try to explain how to work with these tools to make captions available for you. Next slide, please. First of all, let's talk a little about Zoom. Zoom is, as I said, a video conferencing platform. It has built-in option for automatic captioning for meeting recording. It can work only if you record the meeting, and the captions are added after the meeting, and you can see the captions only on the recording if you look at the recording after the meeting. It can be a good option, but of course you cannot use this option for live captioning when the video is happening. By the way, this option is free, so you can use it, but in order to use it, you have to be a paid subscriber of Zoom. So you have to pay for Zoom, then you get this option for free. On Zoom, if you want to have live captions, you have to use another utility or program or something. And of course, there is the usual way of having a person who will type the captions, and it will show, as we see the captions right now, on the bottom of the screen. Next slide, please. These three platforms, Google Meet, Microsoft Skype, and Microsoft Teams, all of them have free options for live captioning built in. This is automatic captioning. You can turn it on. It doesn't cost you any money. So if this is what you want, to have captions for free on a video conferencing platforms, you can try these three platforms, and you can see if the automatic captions working for you good enough. This option, as I said, are built in. You don't have to do anything. No other third person is involved, and it is very convenient sometimes if it works well enough for you. You have to try it first. Next slide, please. This is an example. We sometimes use automatic captions in our meeting, only in small meeting when we have people who know English well and speak them good enough. In this picture, you can see the captions that are produced automatically, live caption, automatically created, and it is very accurate in this case, no mistakes. And another advantage is that it comes very quickly, almost no delay. So it is very good when you listen and read at the same time. Next slide, please. Google Live Transcribe is an application that runs on Android smartphones.
Here's a matching video.
Excuse me? Oh, someone said something. Okay. This is a very good application. It works good. And if you want to work with it while you are listening to a video conferencing like the one we have now, you can just put it close to the loudspeaker of your computer, and then it will listen to the audio that's coming out of the loudspeaker and will translate it for you. You can try it. It sometimes works nicely, and it can be a solution from time to time if it's good enough for you. Next slide, please. Google Live Captions is another option that exists only on Android smartphones. This option is an option that can work with any video or audio on the internet. You just turn it on and it will show captions for anything that you see on your Android smartphone. Also, of course, Android tablets and other devices that works on Android. So it is good to try this option, but this option works only on new models of smartphones. The old ones still do not operate it, and it usually comes to more and more models of smartphones these days. Next slide, please. StreamText.net and Google Docs are two options to use if you want to transfer captions over the internet. StreamText is usually used by professional captioners. If they want to transfer the captions over the internet, they give you a link, and with this link you can see the captions in parallel to any video transmission that is going on at the same time. So you can use this option. I'm sorry about my cat. So you can use this option to transfer captions over the internet. Google Docs can be used in a similar way for transferring captions. And Google Docs also have some other advantages, because Google Docs can also create automatic live captions. So it can be used also to create captions automatically, and also to transfer captions that are typed by a person. This is very useful, and if it works for you, it can be a nice solution. Next slide, please. Rev.com and Streamer.solutions are two website applications that are usually used on a PC computer, on a personal computer, and they can add live automatic captions to video platforms like Zoom. You have to connect it in a little technical way, but when it works fine, and the captions are quite good. But these two solutions cost money. They are not for free, but the payment is not high. It is much less than using captions created by a human. So if you want these options to pay a little and to have automatic live captions, these options can be considered. Next slide, please. Okay, thank you. I think this is all for now. And I hope you gain some information about making captions on the internet. And if you have questions, of course, I'm ready to answer them.
Thank you very much, Avi. And we will open the floor to questions. If anyone has a comment, please feel free to make it or ask a question to Avi and not to his black cat. I have a very simple question to start off with, Avi. What is an Android?
Oh, Android is an operating system of smartphones. Usually, most of the smartphones today are working either on iOS, which is the Apple operating system, or on Android, which is the Google operating system for smartphones. So Android is today the most widely used operating system for smartphones.
Great, thank you. So one of the things that IFHOH has started to do is to have some of its meetings that are just between a few people on Google Meet. We did have an experiment of trying this for the entire board, but we found that it didn't work for the entire board because it was not accurate enough in terms of all of the different voices of people from different countries. And not everyone was comfortable with it. So we either have, in the past, we tended to use meetings with just typing on Skype, but we will be looking at some other options of speaking with the professional captionists. For a webinar like this, we would never go with just automated captioning. We would always have professional captionists. Usually automated captioning is for very small interactions, one-on-one, or 2 or 3 people. Generally, if you go with larger groups, you need a professional real-time captionist. Is that, what do you think about that, Avi? What would be your assessment?
I agree with you with most of what you said. I think also that platforms like Google Meet with automatic live captioning can be good, but you have to try it first. It is not good for everyone. And some people do not feel comfortable enough to use it. So, but it is very recommended to try. Something more important to say that as for now, it is working only in English. So if you need another language, you have to wait. It will come, but as for now, English only. If you need other languages, by the way, you can use the live transcribe application. As I explained before, this application can listen to your loudspeaker, and the live transcribe application have about 60 or 70 different languages. So you can use it with your languages for almost sure. But the quality of other languages, which are not English, are not as good as the quality of English. So you have to try it with your language and see if it's good enough. And if it's good enough, you can use it, and it is very useful.
we're open to any comments or questions that people may have, either about technology or any aspect of what we've been discussing during this webinar. So we have a comment. Can we invite you in the Philippines and other advocates in online webinar discussing these apps? This is from Lauren Maries of the Philippines. And Avi, would you be willing to be invited to an online webinar that the Philippines would organize?
Yes, of course. If you want, we can organize something and maybe do some demonstration, or we can try it together if you like.
And I would answer, for me, absolutely, I'd be delighted. And Bowen, yourself?
Of course. Mm-hmm.
Yes,
Definitely.
so
Mm-hmm.
we're here. People who know me probably know I'm not the greatest technologist. I'm a person who likes to drive a car. I don't need to know how the engine works. And it's the same with technology, like all the apps. I just want to be able to press a simple button and get it to work. And for some of these apps, that's exactly what is the case. They've made it a little easier and simple that even a person like me can learn to do it. One of the webinars I attended this summer, they said, just be patient with yourself. You can't learn this overnight. It takes a little effort. It's like driving a car. You can't drive a car overnight. You just have to engage in it from practice and seek advice if needed. But I think that as hard of hearing people, being familiar and knowing these different applications make a difference for improving our accessibility. The other thing I did want to say as well is that traditional means of communication, like use of devices like hearing aids and assistive technology, absolutely are important as well. These apps don't replace hearing aids. They don't replace assistive devices. They're all extra tools to enable us to communicate more effectively with other people, so we're not feeling isolated and alone. So I think that at this point, if I don't see any more questions from the audience, I will just ask our panelists, Bowen and Avi, for their last words. Bowen, we'll start with you.
Thank you. Again, it has been a pleasure to speak with all of you and share our work in response to the COVID-19 pandemic. I think 2020 has been a very interesting year for all of us, and even though there are some struggles, there's still so many things that we learn from this, such as trying to using an online platform for us to communicate in a way that it help bring us all together. And I think moving forward, we would love to continue to keep in touch with you to hear what your work has been in your local communities and share some of the successes that you've had in advocating for better access, or if you have any questions, or especially around like young people, because that's what our federation is about, is to support the hard of hearing young people in the navigation of education and going into the workforce after they graduate from school. So please feel free to reach out, and I look forward to the collaboration, and we're all in this together to make it fully accessible and inclusive for hard of hearing people in the different parts of our lives. So thank you.
Thank you, Bowen. Avi?
Okay, thank you everyone for coming, and I was glad to show you some of the options that you have today to better use the communication challenges that we have in this period of the COVID-19. So I hope you will all try some of the advices, and if you need some more information, please do not hesitate. You can contact us and ask questions. We will be happy to help and solve technical problems as we can, and help you to communicate better in these challenging times. Thank you.
Just before we close off, I just saw now in the Q&A question. We have a few more minutes, so we will answer this question. What are the other options that we can provide in terms of awareness for hard of hearing people, especially this trying time that we are left behind prior to social impact of pandemic, other than a clear face mask? So what are the options other than a clear face mask in terms of creating awareness of hard of hearing people?
I can answer that. Other than a clear face mask, another way to inform people is that like requesting text-based form of communication. So for example, there's so many commonly asked questions now wherever we go, the screening question before we go into a restaurant or a medical clinic. So one way to make it easier is for the restaurants and medical clinics and any other public places in general is to provide a list of the commonly asked questions right out in the front or at the reception, so that we can clearly see what the questions are while we ask them. So that's one way to make people be aware of the different ways to communicate the messages to the different groups of people, because they're not just beneficial for those who are hard of hearing, but also for those who are not familiar with the English as a language, or even any local languages in the countries. And even more so, some people may have auditory processing disorders and any other communication challenges. So having those written forms of communication can be helpful.
Avi, do you want to add?
Well, I think even the clear masks that was mentioned, they are not perfect. They have several problems. So sometimes there is fog on them, and sometimes it makes problem to breathe. So in many places, the medical staff do not want to use them. It's a real challenge to work on this option alone. So let's try to work on this before we try to find some other solutions. In addition, I can say that we can also try to use some technology in addition to this mask. For example, if we just hold our smartphone like also Bowen did before, if I hold the smartphone when I start the live transcribe application like this, then everyone can see what I'm saying. Even I have a mask on my mouse, you can still read what I'm saying. So this is some simple way to overcome the mask problem. If you want to use this kind of solution, you can do it. So because it is not depend on the other side, you can hold it by yourself and maybe understand better the medical staff or other people that are talking to you. So this is what I can say about this issue.
I would just add that I think it's really important for us as hard of hearing people to be upfront about our hearing loss. If the other person doesn't know that we have a hearing loss, then they cannot make adjustments. So we need to be upfront, and we might just give them one or two tips. For example, I'm hard of hearing. It will help me if you speak at a more moderate pace. And if you could write down important information, that would be helpful. I'm thinking that this would be a kind of statement that you would make when you're dealing with a clerk, for example, in a store. But I also think the idea of using your own smartphone kind of gives you power, because you can use the smartphone to communicate with the other person, and it does automated captions for you. You could also potentially use your assistive listening device. You wouldn't hand the device over to the other person, but you would have it there and explain, I'm hard of hearing, I'm using a device that helps to amplify sound. You need to explain it, because otherwise people think that it's some strange device. But now with the use of smartphones and other devices, people are a little more accustomed to technology being used. And I think that they're a little more accepting even of use of assistive listening devices like FM systems. So I hope we've given you some additional answers to your question about, besides clear face masks, some other strategies that can be used. But please also go to our website where there's some additional information. So to wrap up, I would like to take this opportunity to again thank our captionist, Tracy Remke, and to our two sign language American, not American, but international sign language interpreters, Dennis Hugiven and Adam McCormick, and my apologies if I'm not saying your last name correctly. And the International Disability Alliance has provided us with their Zoom platform and with their staff to assist us in organizing this webinar, which we greatly appreciate. And for this session in particular, the work from Dragana Djokovic and also Emma Fan. Thank you everyone for making it possible for us to have this session. We will just do sort of an invisible clap of hands for you. Thank you to my two co-panelists and to you, the presenters. We will be following up with you from this webinar, so you'll be hearing from us further. Have a great rest of the day, whatever part of the world you're in, if it's evening, afternoon, or as in my case, morning. Have a great rest of the day. Thanks and goodbye.